Welcome to Health Source of Glendale, Arizona. Today's topic, disc injuries and back pain. Herniated discs are a much more common back pain than most would suspect. The thing is that for many with a herniated or bulging disc, no symptoms are present. In fact, it's estimated by some studies that as many as half of all adults have some sort of disc abnormality, but a majority don't experience any pain. If, on the other hand, you are experiencing pain in your back and legs, the cause may very well be an injured disc. An MRI or CAT scan, as well as a number of physical manipulations and tests, verify this. An EMG or electromyographic test can check to see if the nerve function is affected and a course of treatment is determined. But let's back up a bit and take a look at the disc itself. The structure of a disc. The discs are semi-solid structures that rest between each set of vertebrae to provide cushioning and movement for the spine. Composed of two strata, the inner nucleus pulposa and the external annulus fibrosus, the disc is uniquely designed to provide both shock absorption and flexibility. The inner core is gelatinous in nature while the outer ring is a tough fibrosis shell. What happens in an injury? The most common location for injuries to occur is the lower lumbar or spine. Whether this area takes more abuse in day-to-day activities or the curvature puts more strain on the disc hasn't been determined. Over time, the outer layer deteriorates, allowing some of the inner material to extrude a bit or even fully, resulting in a complete tear in the tissues. These tears will heal over time, but if the extruded material places pressure upon a nerve or nerve root, the result is pain in the leg, buttocks, and or low back. Oddly, most herniations occur in people in their 30s and 40s, and they usually happen in the morning. While there are theories that imply that decreased hydration in the morning may be a correlating factor, there's no definitive conclusions as of yet. With pressure on the nerves exiting the spine, the afflicted may suffer pain, numbness, and a partial to complete loss of function. While the pain is similar in some ways to sciatica, it is often much worse in degree. Treatment can vary from conservative to invasive depending upon the seriousness of the injury and the level of pain experienced. Conservative treatment of back pain. 80% of those treated conservatively have made a full or significant recovery when evaluated 5 years after the initial injury. Initially, there's a brief restriction of physical activity followed by a course of physical therapy. Medications to control pain, anti-inflammatories, both over-the-counter and prescription, and occasionally steroid injections are all available as well. Over time, most disc injuries heal and the body reabsorbs the extruding material. Surgery for an injured back. For those who don't respond to conservative treatment or whose injury is very significant, there's always the option of surgery. Today's surgeries are much less invasive, with microdiscectomies and laminotomies being chosen over more traditional fusions and immobilizations. Keeping the big picture of renewed mobility in mind, you and your doctor will come up with a comprehensive plan that will get you back on your feet and alleviate your back pain. There are so many treatment options that you're sure to find something that meets your needs. For more information on topics like this, go to www.arizona.healthsourcechiro.com/city/Glendale.